Good morning. Good morning, and welcome to SOS Illinois' Women in Leadership Conversation Series. Today, we will be focusing on women leading in health and nonprofits. My name is Dr. Delphine Rankin, and I have the pleasure to serve as CEO. On behalf of the Social Justice Committee, I'm excited to welcome you to the last of our conversation series, celebrating Women's History Month and Women Blazing the Trail. Today, you'll have the opportunity to hear from 4 dynamic women who will share their journey and their experiences with you. I encourage you to join in the conversation. You may add questions to our chat, but most of all, I encourage you to take in all of the gems and jewels that these ladies will be sharing with you. Now, without further ado, I would like to introduce our moderator for today, our Deputy Director of Family and Community Enrichment, Ms. Christy Richardson. Christy?
Thank you, Delphine. Good morning, everyone, and welcome to our grand finale of Women in Conversation. Today, I'd like to introduce our panelists, and we will have Shelley Long, Manager of Community and Employee Engagement with Blue Cross Blue Shield of Illinois. We have Dr. Suzette McKinney, Principal and Director of Life Science, Sterling Bay. We have Dr. Nicole Robinson, CEO, YWCA, Metropolitan Chicago. And we have Dr. Renee Walker, Senior Director, Community Health Initiatives and Program Development, Patrick M. Magoon Institute for Healthy Communities, Lurie Children's Hospital. So we will begin with Shelley Long and her introductions. Welcome, Shelley.
Thank you, Christy, and good morning, everyone. And thank you to Delphine for the opportunity to speak with you today alongside a great group of women here. My name is Shelley Long, and I'm a corporate social responsibility leader at Blue Cross and Blue Shield of Illinois. My responsibilities include developing and implementing strategies that enhances and expands our organization's social impact footprint in an intentional way that creates progressive impact and improves health equity across Illinois.
Thank you, Shelley. And next in our introduction, we will have Dr. Suzette McKinney.
Thank you, Shelley, and good morning, everyone. Thank you, Christy, and good morning, everyone. My name is Dr. Suzette McKinney. I am a principal and the Director of Life Sciences at Sterling Bay. I am also a nationally recognized public health expert, but in my capacity here at Sterling Bay, I lead the strategy to expand our company's footprint in the life sciences nationwide. I also interact with the corporate, scientific, and academic communities to help grow and expand the life sciences ecosystem here in Chicago. Prior to joining Sterling Bay, I also served as the CEO and Executive Director of the Illinois Medical District. It's a pleasure to be with you all today. Thank you.
Welcome, Dr. McKinney. And next we will have Nicole Robinson in her introduction.
Good morning, everyone. Thanks so much, Christy. I'm Nicole Robinson, CEO of the YWCA of Metro Chicago. We are a $44 million organization, and we have about 325 people who are committed to our mission of eliminating racism and empowering women. I love that mission. It speaks to who I am as a human being. And we do our work and achieve that mission by building community resilience to heal from trauma and belong. So that's whether you're a survivor of sexual assault or you experience chronic violence in the community every day. We help unleash youth potential, and we build the economic equity that communities need to thrive. So I'm delighted to be here today.
Thank you, Nicole. Welcome. And last but not least, we have Dr. Renee Walker, and she will give her introductions of herself. Renee.
Thank you, Christy. Good morning, everyone. I'm glad to be here. I'm Renee Walker. I'm a senior director at Lurie Children's Hospital. And in my role, I provide tailored support for community-facing programs. I work to identify new community health initiatives that are in alignment with the institutional priorities, as well as relevant to the communities that we serve. I collaborate with a variety of stakeholders, including governmental agencies, community-based organizations, all with the common goal of reducing and eliminating health inequities and promoting racial justice across the city of Chicago. I'm glad to be here with you. Thank you.
Thank you, Renee. And thank you all panelists. As we begin our series on this morning, I would ask that the audience will know that the chat has been disabled. And so we'll have questions and answer. That's where you'll put your questions. And then we'll go through them throughout the series this morning. So let's begin with our first question with all the panelists. Okay, good morning to everyone. First question, what is the area of expertise and what inspired you to pursue that career? We'll start with Dr. McKinney.
Okay, so my area of expertise is public health and healthcare. However, I now work within commercial real estate, but in the life sciences, which is a healthcare and public health related field within commercial real estate. What inspired me to pursue public health and healthcare as a career was, quite honestly, just a longstanding desire to help people. I grew up on the south side of Chicago, so I am very well aware of the health inequities and healthcare disparities that we see, not just here in Chicago, but in vulnerable communities across the country. And so my desire was always to help improve people's health and their healthcare outcomes. And that is what led me to my current career field.
Thank you. I love that combination. That's unique. You're in a unique situation there. Thank you. Good information. Shelley, you want to give feedback?
Sure, thank you, Christy. Actually, to be honest, I didn't know my career existed back in college, right? But I knew I had a passion for community. I grew up maybe a rock's throw away from Chicago in Gary, Indiana. And I too saw the different disparities facing our communities and wanted to make a difference. And so it started at a young age, volunteering in the community, going off to college at HBCU, volunteering there and coming back to Gary. I ran for office, a couple of times, and I still wanted to make an impact. So I, decided to do a few things in the community to serve. And it actually just started with a conversation within my network with someone. And I, said, hey, I'm looking to do a little bit more in this space. Does something exist? And she reached out to someone in her network who I had a conversation with, and that started my career in corporate social responsibility.
And here you are. Thank you.
Here I am.
Thank you.
No problem.
Nicole, give us feedback, please.
Sure, absolutely. I love that there's Southsiders on the call because that's part of my journey. I claim 4 neighborhoods in Chicago. We have 77, and I claim Roseland Heights, Altgeld Gardens, Inglewood, and now Bronzeville, where I live today. And my grandmother came to Chicago from Arkansas as a part of the Great Migration. And when I just think about her journey, my mom's journey, my dad's journey, I quickly learned that apparently there are underdogs. There are people who win and there are people who are underdogs. And I was always curious about why some people thrive and some people don't. And seeing that I didn't have equity in my lexicon. I didn't have social innovation and philanthropy. I wouldn't have used any of those words, but I could see that dynamic and what it meant. So I was always curious about, how do I do well while doing good? How do I create environments where everyone wins, right? Where we all have our basic needs, where we all have opportunities, where our genius is unleashed. So I think that was my motivation, seeing that and not just being driven by my own personal power, an opportunity, but what could I create for other people?
Awesome. Thank you. Thank you. And Dr. Walker, let's hear what you have.
So like Doctors McKinney and Robinson, I too am from the South Side of Chicago.
Oh.
And like and like Dr. McKinney, my area of expertise and background is in public health, specifically community health and global health. And I began making the connections between some of these social factors. So poverty, education, neighborhood context, access to healthy and nutritious foods, and these social factors in health outcomes. I began traveling internationally, primarily to developing countries, and saw these similar trends during my travels and work there. And that really piqued my interest. And I began to ask the question, why, to how these social and cultural and economic factors impact health.
Oh, thank you. Thank you for indulging. Thank you all. We will go to the next question. We don't have any questions and answers yet, so we'll go to the next question. What are the biggest challenges that women in health and nonprofit are facing today? Looks like you're ready, Dr. Walker, so I'll just go ahead and let you speak.
Thank you. So one challenge is pay inequity, despite having equal productivity, academic qualifications, and experience. And we know that persistent and harmful gender inequities not only disadvantage women workers, but also weaken systems and impedes progress towards gender pay equity at all levels. So recommendation to kind of address the gender inequity is pay transparency and pay equity. Another challenge that I see is the work-family balance that may hinder career progress. So meetings in the 8 a.m. hour or the 4 p.m. hours can be challenging for women who have caregiving responsibilities. So recommendations include flexible work hours, a hybrid work schedule, and an institutional commitment that meetings that are scheduled on average, 8 a.m., 4 p.m. should be reserved for extenuating circumstances.
Thank you. Thank you. Shelley?
Thank you, Christy.
You're welcome.
I agree, I echo what Dr. Renee Walker has said. And I also look at it as, one of the challenges that we are facing is really looking at what we do, right? And so I would define our challenges as a standard that we could be faced with as women in this industry where, a lot of times we're our worst critic, our worst enemy, right? And sometimes we get too focused on those things that are looked at as challenges or hindrances. So I would really encourage us to do what we do as women. We rise to the occasion, we find the solution, we find a way, right, to get to that mark, to that target. And so I would encourage us to continue to do so and use those challenges as stepping stones to overcome them.
Thank you. We rise to the occasion. Absolutely. Thank you. Dr. McKinney?
Sure. Thank you for the question. I would say, first and foremost, I agree with everything that's been said so far, but I also think that sometimes as women in our workplaces, we get assigned what I like to call the non-job description responsibilities, planning the holiday party and decorating the office and things like that. And I think because of the inherent nature of women to always want to help everyone else, we willingly agree to take on those responsibilities. However, we tend to get pigeonholed into the places and the spaces within the workplace where people think we should be, or where people think those are the only places where we can be. And so an approach that I have taken in my own career and what I advise younger career professionals to do is to not become satisfied with the status quo. Don't be satisfied with being mediocre. Do the things that you need to do to prepare yourself to advance and excel, and don't allow another person's opinions to restrict where you are able to go and what you are able to do. If there's an educational opportunity that you're interested in, go for it. If there is an educational aspiration that you have for yourself, go for it. And, you know, if you are following one of my, I'll just call it life mottos, to stay ready so you don't have to get ready. When that job promotion becomes available and it's one that you're interested in, because you've prepared yourself, go for it.
If you're taking notes, take notes for me. I can't take notes. That's awesome. That's good wisdom there. Thank you. Thank you. Nicole.
Oh, I love all of these comments.
Yes.
And what I do know as well is that as women and people of color, we can do everything right and still not get where we need to be and what we deserve to be. So I want to acknowledge that. And when I think about, like, part of my career, I spent about 19 years in corporate America, part of that in finance. I love that Dr. Walker talked about being in emerging markets. We should talk about that one day. So I've had an opportunity to see, you know, what it's like for women around the world as well. And when I think about the nonprofit sector, I think about systems, and we still have to change systems. So 79% of board chairs and EDs nationally are white. I feel like I'm living in a bubble and the dream in Chicago because I get to be with fierce women CEOs, Black women CEOs, like the folks on this call all the time. But I know when I look at the data, though, the data is queen, and it's still majority white. And in a nonprofit context, board chairs make the decisions about who are CEOs, right? So if they're predominantly white males still making the decisions, that's problematic. If you look at public policy, so when we talk about, Dr. Walker mentioned pay equity, or if we think about, you know, what are the structures and systems we need in the workplace so that women are not just paid more, but they're afforded the opportunities around family and things like that to sort of thrive and not lose their place. That public policy drives that. And public policy is dominated, it is not a diverse field. So the people who are making the policies are not diverse, and they're making decisions about what happens to Black and Brown people. The other thing I would say about the nonprofit space, you know, again, I have this privilege, like it's a complete privilege to lead the YWCA. But what I also know is from my other work, there's bigger multinational NGOs, the World Food Program, Save the Children, the international, like these are humongous organizations that govern what happens to Black and Brown people all around the world. And they're still not, some of them not diverse institutions and places. And for, you know, so that's, to me, is just another big piece. And then I would just say philanthropy. Chicago is the third largest fundraising market in the country for private philanthropy. And as new women and people of color ascend into leadership, they aren't always given the investments that their predecessors have been in the same way. And when you lead a nonprofit, it is about raising money. That is like 70% of my job is to raise money. And I think that that's a big piece too in the sector for women. How do we unlock that?
Thank you. It's a lot of nuggets and we're just getting started. Thank you so much. We have a question. How do you avoid feeling overwhelmed when facing all these large systematic issues we are battling? You could go ahead and speak on that, Nicole.
Sure, I love that. So people probably heard me say this. I love Bell Hooks. I am sad that she is not here, but she's a feminist, a social commentator. And one of the things she's widely known for saying is, you know, it's really important for us to build communities of resistance and resilience, places where we know we belong, right? Because when you're in leadership, it can be isolating, right? You're dealing with tough problems. Not everyone supports you. People compete. There's competition. That's how structures are set up. So people aren't always supportive. So you need your family, your sisters, your friends, whoever it is, you need that network, your next door neighbor, whoever it is, that when it gets tough, you have that sense of belonging, being able to get away and get out, like step away from the work so that we can recharge. Some of your, at least for me, some of the most creative moments happen when I've stepped away from it for a week, when I've just let that problem go and then come back to it. And then just being able to, that community is also that space where you have the kitchen cabinet and you can talk to people, because you can't always talk to the folks inside your organization. You got to get outside of it. So I think that's super important for me. But I know someone else probably has a comment on that one as well.
Dr. Walker, want to speak, or you want me to repeat it?
No,
The
it's fine.
question.
I'm good.
Okay.
And I totally agree with Nicole saying. I think also for me, it's leaning to those things that gives me comfort and joy, whether it be faith, whether it be family, whether it be, whatever, yoga, those things that help you stay grounded, because it can be overwhelming. Prior to my role at Lurie Children's, I was a professor at the University of Wisconsin for 10 years, and I worked 7 days a week. And now as I transition to this role, I set boundaries. At a certain time, I am not checking email. I hear a chirp in the middle of the night. I'm not going to roll over and check it. And those are things that I did, my past career. And to the greatest extent that you can set boundaries, I think for me, that has been better for my physical health, for my mental health, just setting boundaries.
That was good information. Thank you. Dr. McKinney.
Yeah, I think Renee and Nicole have both hit the nail on the head. You really just have to find those things or identify those things that bring you comfort, bring you solace, and bring you joy. I love that Nicole mentioned having the kitchen cabinet, people that you can bounce things off of. I call it my personal board of directors, because for those of us who work for companies or work for organizations where we have boards, sometimes you need your own personal board of directors. And for me, it's not about, convening that entire group every time there's something I want to discuss. Sometimes it's just reaching out to one of the members of my personal board of directors. But what I know is that no matter when I reach out to them, no matter which of them I reach out to, they are always going to give it to me like it is. They're going to tell me the truth. They're going to help me check myself. And they are also going to help guide my decisions and help me ensure that I'm not making decisions from an emotional perspective.
Thank you. You need that confidence. Shelley, let's hear what you have to say with the question, concerning the question.
Thank
Thank
you,
you.
Christy. I agree with everything that the panel has shared. I will also say, when you're looking at all of those obstacles, it can definitely be overwhelming. And I would say take a bite at a time, right? Don't try to attack everything all at once, but really just take that one step and be confident in taking that one step. Know that it is okay for you to shine. Know that it's okay for you to shine alongside another woman. You shining does not dim her light, and she shining does not dim your light. What happens is both of your lights make the room brighter. And so I would say just embrace that, take your steps, and enjoy the ride.
Thank you. There is a remedy for being overwhelmed. Thank you. You all have answered the question. We'll go to our next question. What is a common misconception people have about women in healthcare and nonprofit sectors, and how can we combat these misconceptions and communicate more effectively? Go ahead, Shelley.
Well,
Sorry,
ready for that one. I thought you were going somewhere else.
You want me to repeat?
Yes, please.
Sure. What is a common misconception people have about women in healthcare and nonprofit sectors, and how can we combat these misconceptions and communication more effectively?
I would say a common misconception, again, I'm in the healthcare space, but I'm also within that corporate social responsibility space. And so I sit in a very unique position. It's almost like a nonprofit, right, within a corporate sector. And so I would say, one of those misconceptions, again, with thinking about leadership and, honing those new leaders, being able to identify who those individuals are and knowing that they exist. And sometimes, people do not reach back or try to cultivate that new wave of leadership. They may feel like it's not existent and they may have to step outside of a particular organization or area. But knowing that there are leaders everywhere, right? And a lot of times people just need that opportunity, right? Similar to what I shared earlier, I didn't have the experience within CSR. I didn't know that space existed, but reaching within my network and having conversations and raising my hand, because a lot of times you're not tapped. Sometimes you have to raise that hand. There's an old saying that says a closed mouth doesn't get fed, right? And so sometimes we have to be vocal and be okay with that and saying, hey, I'm ready for this opportunity, and raise our hands.
Excellent. Thank you. Dr. McKinney?
Thank you, Christy. One of the things that came to mind for me when I was pondering this question, one thing about women is that when we show up, and no matter where it is that we're showing up, but particularly in the workplace, we show up as our entire selves. And as women, we do have this inherent nature for helping and for compassion for others, I believe. And so I think many times in the healthcare and nonprofit sectors, because we show up with that caring and compassionate, and sometimes that's emotional too. In my experience, I've had people think that just because I carry those characteristics and those qualities, that perhaps, the expertise may not be there or the business acumen may not be there. Just because I'm a caring person doesn't mean that I don't know how to handle my business. And so I do believe that that's a common misperception about women in the workplace, particularly in healthcare and nonprofit. But I think in terms of combating those misperceptions, Shelley brought out the old saying, so I'm going to have to bring out another one. I can show you better than I can tell you. And so sometimes we, yes, we have to show up as our authentic self, but we also have to come in the door and take care of business and do what needs to be done. Because the best remedy, in my opinion, for having someone doubt your skills and your ability is just showing them what you can do. And you don't always have to talk about it. Sometimes things are better left unsaid.
Good answer. Thank you. Dr. Walker?
So that's a nice segue, because I'm going to build off and underscore what Dr. McKinney has said. And I think from my experience, one of the misconceptions is about the ability of women to be strong and effective leaders. And there have been study after study that have shown that women are viewed as emotional or lacking in focus and not considered strong leaders, especially compared to our male counterparts. And in terms of leadership practice, women are often perceived as better team players or more tolerant, more likely to ask for assistance in difficult situations, whereas our male counterparts are viewed as prepared to take direct action. And one way to combat this misconception is to ensure that there are more women in leadership positions in healthcare. And Nicole had mentioned a statistic about the racial composition of CEOs. But if you look at it, stratify that by sex, 15% of CEOs of healthcare systems and hospitals are women, but women make up 65% of the hospital and healthcare workforce. So more visibility of women in senior level positions can help change the narrative of women in healthcare and normalize the role and importance of women as decision makers. Additionally, if we fix the so-called first rung of the career ladder to ensure that there's diversity in middle management, that can lead to greater talent pools of qualified women, which can lead to gender parity.
Thank you. Awesome. Good information. Nicole?
Sure. This panel rocks. They said such good things. I'm like, oh my gosh. So I'll say two things. One, I believe in leading with the head and the heart. And I do think that that's our superpower as women, and we actually don't bring it enough, because we wind up coming in organizations where they're institutionalized in terms of how things work and how you get ahead. And we have a choice. We can navigate organizations, understand what the rules are for our personal progression. And we do need to do some of that sometimes. But what we can also do is advocate for structures and systems to be different so that more women get through, that more people of color have possibilities. That's our opportunity. I was recently reflecting, the YWCA has a accelerator program for Black women-owned businesses called Breed Love. It's named after Madam C.J. Walker. And Madam C.J. Walker was the first woman millionaire, not the first Black woman, but the first woman self-made millionaire. What's interesting in her governance documents for her company is she put in her documents that only a woman could be CEO of her company ever, for as long as it was in existence. Now that actually seems radical for 2023, right? When we think about Fortune 500 companies and this idea, Dr. Walker talked about women being the consumers of specific industries, but those industries are still governed and led by and driven by decisions by men. So I want us to sort of lead with that head and heart and lean in to what our superpower is in those areas. So that's what I'd add to that one.
This sounds like taking our nurturing to the next level. Thank you. Thank you very much. Next question. What changes have you seen in your field in the past 5 years? Dr. McKinney. Thank you, Nicole. What changes have we seen in your field in the last 5 years?
You know, I could probably answer this question a number of different ways, but I think one of the changes that I've seen, you know, we've talked a lot about the lack of women in leadership at Fortune 500 companies, particularly in the C-suite. But I do think within the last 5 years, we have started to see the emergence of more women leaders in the C-suite, perhaps not in the CEO role, but in the C-suite. Even reflecting on my own career, when I took over as CEO of the Illinois Medical District in 2015, I was the first female CEO in what at that time was the 75-year history of that organization. And as we see more and more women, particularly Black women, I believe, coming into leadership, I think what we are starting to see is really we are getting in there and we are showing what we as women are able to do. You know, women are problem solvers, we are multitaskers, and I think what we are showing in these leadership roles across multiple industries is that women can perform at the highest levels. And so that's something that I'm very encouraged by. What I would like to see more of in the healthcare and nonprofit sector is just the cultivation of more women leaders. I think for those of us who are in leadership, we really have to be intentional about helping to cultivate the next generation of leaders, because you know, that's really important. And I think you know, seeing us in those leadership roles helps younger women and younger professionals aspire to those roles as well. So I believe it is our collective responsibility to do all that we can to cultivate that next generation.
Awesome, thank you. That was good. I'm going to revert back. There was a question to the last question and I missed my text. So this is dealing with people. How do you deal with people doubting your abilities despite your title and experience? How do you deal with people doubting your abilities despite your title and experience? Shelley, you want to give us a little say there? Thank you.
Thank you, Christy. You know, there will always be individuals that doubt you, but you can't buy into that negative self-talk. I would say for you to quiet that noise, and similar to, I think it was Suzette that said, you know, just show up. Sometimes it's not, you know, speaking what you can do, but you're just doing the work. So I will echo that And I will say to stand in that space, to know again that you have, if you're in that space, if you've been invited to be in that space or to do the work, do the work. It's not about, trying to prove them wrong or understanding why they feel what they feel about you, but it's understanding that you are there for a reason, and it's fine. It's time for you to stand in that space and own it.
Thank you. That was good. Nicole, give it to us.
Wow, great question. I mean, I've spent part of my career in finance and corporate America. I'm a kid from the South Side, so I feel like I talked about this idea of underdog, and maybe, if you look in Wiki, you see a picture of Nicole, because when I think about all of the experiences that I've had and some of the obstacles that I've faced, but it is about doing the work and showing up to be your authentic self. I'm self-aware, so I love drawing people in by asking them how they can help me. And I think that's part of overcoming some of those barriers of opposition. Like, how do you, because we're all going to have those moments, and everyone's on their own journey with respect to equity, racial equity, gender equity. And, part of my response is not to lash out. Part of it is to help them help me, right? And draw them in around this bigger thing that we're trying to achieve together. So we're always going to face some obstacles, but it's not just the what, it's to how we manage it in those individual moments. And then how do we change the systems and structure so that other people don't face the same challenges. I want it to be different for the next generation of women. I want them to sail through. I don't want them to have to deal with some things that maybe some of us have dealt with in the past.
Pay it forward. Thank you. Dr. Walker?
So again, I'm going to piggyback off of Nicole here, because I think it was very critical what she indicated about letting your work speak for itself. I think that has been my reality, but also I've been fortunate enough to have supervisors in the workplace that never undermined me. So if anyone questioned me, that behavior was called out real time. And I think for those of us that are in positions of power in the workplace, that we have to can't turn a blind eye to ignore comments. We have to call it out. And again, that has been my experience, where if somebody would go around me, that would get checked early and quickly, so that people know that I am leading an initiative, or I am the one that is responsible for whatever the effort is.
Thank you. Dr. McKinney, I think you was trying to speak. Go ahead.
Yeah.
Thank you,
So
Dr. Walker.
again, the comments of the other panelists are right on target. I think the only thing that I would add at this point is to say, again, going back to what I said earlier, you have to do the work to prepare yourself. You must prepare yourself to be in the places and the spaces where you are. There is, we often hear these cliche phrases, fake it until you make it, and that sort of thing. And, I won't say that some of that doesn't exist, because let's be real, it does. However, you absolutely have to prepare yourself for where you will be. And sometimes, no matter the amount of preparation that you've done, there will always be doubters. But I think as long as you're doing your work, you're working hard, and you are showing that you have the skills and the expertise to be where you are, in the end, those things will come through. And I will just share, a personal story. Many years ago, very early on in my career, the person who was my supervisor decided to leave the organization where we were working. And I was asked to fill in his role on a temporary basis until his position could be posted and they could begin the interview process. Well, that turned into a 9-month period of time that I was filling into this role. So by that point, by the time the position was posted and they were preparing to start interviews, I was very comfortable in the role and very confident in my ability to take on that role full time. And quite honestly, what happened was another manager within the department who had nothing to do with the position that I was applying for, went to the hiring manager and said, you know, if I were you, I wouldn't hire Suzette into that position. And when the question was asked, why not? Her response was, well, she's a great worker bee, but she's not a leader. Again, this was someone who had an opinion, and everyone is entitled to their opinions, okay? But she had an opinion, no one asked for it, but she decided to levy it anyway. And I think what worked in my favor in that situation, obviously, we went through the interview process. I did get the job, which was a promotion for me. But what worked in my favor was the fact that I had been doing the work. And I wasn't allowing, as many of the other panelists have said, other people's opinions affect my ability to execute the responsibilities that I had been given.
Thank you. Good answer, good encouragement there. Regarding the next generation and paving the way for other women, what advice do you have for women seeking mentors in this field? How do we get a mentor? How does that happen? Nicole.
Sure. I just want to distinguish too mentor and sponsorship. So depending on where you are in your career, I think you want both. And a mentor is someone who can give you advice. You can talk to them about situations in your professional career and what you're thinking about. They can unlock opportunity and doors in terms of meeting people. But that sponsor is that person who is in the room for you. And I'm lucky because I've had mentors and sponsors. I've had men be mentors and sponsors, and I've had women be mentors and sponsors. And that sponsor is in the room where they're discussing advancement in your organization. They're talking about development. They're talking about who is high potential, right? And who has the potential. It's kind of like what Dr. McKinney just described. That person wasn't a sponsor, the person who spoke out against her. But I'm sure there was someone who was a sponsor and said, no, I know Suzette, she's a leader and she can do it. Trust me. Trust my word. And you want people who are doing both, because those are two different things. In terms of how you get one, I always recommend mentors, try to find someone inside your organization and outside, because if you're trying to navigate a large institution, you want to find someone who's been there a while, who's in your field, and who's willing to be a mentor, particularly if your organization doesn't have like a formal program. And you want to know what you want too from the relationship before you seek out who it is. So you can set some ground rules around, hey, I just want to talk to you 4 times a year or whatever. And I want career advice on how I navigate the organization. And then externally, I think it's in your sector. It's about where you want to go. So I'm in the social impact sector. I spent time in corporate America. So I like to mentor people who are in corporate America or in the social sector, because for me, I understand them both. And I want people to win. So I think through networking outside your organization and your space, I can remember I used to work at Kraft Foods and Mondelez International, and I had a colleague who had spent a 25-year career inside Kraft, been wildly successful, and then suddenly was getting outsourced, was getting downsized and no longer work. And she said to me, I don't think I know anyone outside of Kraft. Like not a contact, like very few, like unless they were her supplier, she didn't know them. And that's what we want to do. We want to not just be in a bubble inside our institutions, but also network in our sectors. If you're a CPA, the National Association of Accountants or the Chicago group, if you're in healthcare, like what's the industry sector you can be a part of so that you understand the bigger picture, how you build your skills outside of the organization. And if you want a career change in that sector, you want to build a career change in. So I don't know, does anyone want to add to that one?
There's nothing else to add, no. joking. You're spot on Nicole. I mean, I'm trying to take notes because I think you hit so many key components of that. I too have just kind of cold called potential mentors, people who are in positions that I want to be in. I think I co-sign everything you said in terms of both internal and external mentors. I have the great fortune of being in the Leadership Greater Chicago's class of 2023 now, and I've been able to, thank you, to reach out to those who were fellows, a decade ago and get mentorship from them. So it is really finding those people, those key people to kind of bounce ideas off, to kind of provide guidance about professional development opportunities. And I think that mentorship is very, very crucial. And I'm glad to see that there's quite a few people who had asked questions in the chat about that and that we're having this dialogue. And Dr. McKinney, feel free to jump in.
Well, first, let me say welcome to the family. I'm LGC class of 2019.
Awesome.
But I would say both you and Nicole are correct. Mentors are out there. They are available. Many of them are just waiting to be asked to be a mentor. So, Nicole listed a number of ways that you can identify a mentor. I would also say going to talks and engaging in programs like Leadership Greater Chicago. The Chicago Urban League has a similar program. It's called Impact. It is a leadership experience and leadership development and nurturing for, early to mid-career professionals. And each of those programs host a number of talks where industry professionals are coming in to talk to those classes. So again, many mentors are waiting to be asked. The caution that I always give is when you think about a mentoring relationship, you will get out of that relationship what you put into it. The mentor's job is not to seek you out. It is your job to seek the mentor out, and it is your job to remain engaged and in communication with that mentor. So if I'm your mentor and we set up regular calls where we're going to talk about issues that are important to you, I'm probably going to give you some follow-up items, some homework, if you will. If I don't hear from you for 6 months, guess what? That's on you. Because you are the person that needs the mentoring, that wants the mentoring relationship. And, a mentor will give you all of those nuggets. A mentor will give you that advice, as Nicole mentioned, and help you navigate your pathway to get to where you want to be. But you got to stay connected. You got to stay in touch. And I find that that's one area where a lot of mentees tend to drop the ball, if you will.
That's good. That's good. Shelley, you have anything to add?
I mean, they said it. I mean, that is all of that and then that and then more. I would add a couple of things, I believe it was Sue who said, time is of the essence and it's valuable for all of us, right? So make that time with your mentor count. Be intentional with the individual and with yourself. Understand the why. Define that why before you meet with them. Define the expectations that you're looking to gain before you identify someone. And then again, continue to be consistent. As the other panelists have said, if you're not, it'll come out in the wash, right? So make sure that you understand what it is that you're looking to get from that relationship and be able to build from that, step out of your comfort zone. Don't just connect with people who are in your field or who within your network. Talk to other people, join other organizations, expand that reach, broaden that horizon a bit more, and that will give you a better outcome.
Thank you. It's important. Mentorship is important. And so you all have spelled it out and broadened. You said some things that I didn't hear about before, like sponsorship. I heard of mentor, mentee, but not sponsorship. So thank you for that. As many of you deal with issues outside of your organization that impact your work, how do you collaborate with other organizations or the broader community? As many of you deal with issues outside of your organization that impact your work, how do you collaborate with other organizations or the broader community? Dr. Walker?
I think that is a good question, and especially because, we can't do this work alone. We don't work in silos, and try not to. And so I've been in my role for a little over 2 years, and thankfully that there's a good degree of trust, between the communities that we work with in the institution. But that can be taken away in an instant, because typically there's a lot of distrust between communities and large institutions. So when I started my role, I came in where there's a lot of relationships that were already established, but we continue to maintain those relationships. We have listening sessions. We go out into the community. Meetings are out in the community rather than coming to Streeterville, where I'm located. So we do a lot. We work with residents, different gatekeepers and stakeholders within the community, and we invite them to our space. But it's really about learning and listening and maintaining relationships with various organizations, community residents, et cetera.
Thank you. Dr. McKinney?
Yeah, so the first thing I would say, I'm trained in public health. And one of the first things that you learn in public health is that, first of all, and we all know this, you can't tackle problems alone. And really complex problems require a systems approach. And what do I mean by systems approach? What I mean by that is, any particular complex issue that you are going to work on, there are multiple disciplines, multiple areas of specialty that will be required to solve that problem. I think for me, by nature, I'm a natural collaborator, but I really approach my work, and especially work within communities and work with others from that systems perspective. One of the largest collaborative efforts that I've ever worked on was, again, during my time as CEO of the Illinois Medical District. And it was right after Rush University Medical Center discovered the 16-year difference in life expectancy if you live on the west side of Chicago as opposed to the Gold Coast. And so we came together as a number of large organizations, the leaders of those organizations, to really look at what were the underlying factors that were driving the life expectancy disparities, and in essence, also the healthcare disparities that we were seeing on the west side of Chicago. Now, as I said, I am a product of the south side, but what I didn't say is that I'm also a product of the west side. So that was something that I felt was very close and near and dear to my heart. And so it became convening community members, individual community members, families, organizations, and other institutions that were working on the West Side or working on behalf of the West Side to really address some of those underlying issues that were contributing to that larger complex problem that we all wanted to solve. And Renee said this as well. It also included going into the community, not going in telling people what you were going to do to help them, but rather going in and asking people what they thought the solutions were, and then implementing the solutions. No one knows the community better than the people who live and work there. So those are some of the sort of strategies that I use when I'm working with communities, but in particular when I'm working in collaboration with others to solve complex problems.
Good information. Thank you. Nicole?
Sure. This panel is in such alignment because one of my favorite leadership proverbs is an African proverb. I know people know it. If you want to go fast, go alone. If you want to go far, go together. I live by that in terms of how I lead. When I was chief program officer at the Greater Chicago Food Depository, we had a vision around ending hunger and transforming the food ecosystem. And we were at this moment where I had ideas that could not get traction before the pandemic. But once the pandemic hit, we were in a moment where we created a food equity council, stood it up in the middle of the pandemic, had people across the city who were concerned about food access, whether it was retail food access, farmers market food access, whether it's local food pantry access from farm to table, the complete gamut. And it was a diverse group. It was people who never had voice before from community who were working on the ground every day, whether it was Inglewood or North Lawndale, who were suddenly at the table. But then it also included philanthropists like Margot Pritzker or the Chicago Community Trust, alongside city government and state government, all getting together about, and we created a roadmap, which ultimately got $10 million in funding. And I mentioned that part too, is because the city we have big challenges: poverty, racism, violence, mental health challenges. These are too big. And I joke about hunger. I said it's been around since Moses, right? There's always been an issue. So I think that we have to work together to solve them, and not just within the nonprofit sector or healthcare. It's every sector working together, because there's this intersectionality. I hear, I'm so proud of the public health community, because you've leaned into this idea of social determinants of health and really understanding that someone's health isn't going to improve if they're hungry, if they're worried about how to pay their rent, if they're worried about how they dodge bullets, right? If they're dealing with mental health challenges, how do I get childcare? All of that is complex, and families are overwhelmed. So it's our responsibility to solve it all. And I know that seems pie in the sky, but that is what we need to do.
It takes a village. It takes a village. Thank you. Shelley?
Thank you, Christy. And I echo what the panelists have shared. To their point, you have to work with those who are on the ground level, who are doing the work, who know the communities, who are seen as trusted partners, to cultivate and sustain partnerships in those areas. COVID-19 really was a wake-up call for all of us, right? And we, knew of those disparities facing Black and Brown communities. But what the pandemic really did was really shone a glaring light on those disparities. And so in my role, which is part of a larger team here at Blue Cross Blue Shield of Illinois, we were really able to collaborate not only internally, but with our partners that we have developed in the community to really look at how we can combat those issues in a different way, in an innovative way. We actually stood up 2 of our Blue Door neighborhood centers during the pandemic. We had to reimagine what social impact looked like in the midst of that pandemic. We went to, a 5-day work week to being shut in, right, for 18 months, right? And that really impacted that level of engagement with employees and collaboration internally, but it did not stop our commitment to our communities. And so we were out there during the pandemic distributing PPE kits to help our fellow neighbors to remain healthy, to provide healthy food options for those experiencing food insecurity, and serving alongside our partners as volunteers in the community. So what it taught us that we really had to be nimble and adapt to the ever-changing environment that we were all experiencing for the very first time in our lives, and develop a plan of action to stand with our members and our communities that we serve.
Thank you. Thank you. Good information. What changes have we seen in your field in the past 5 years? What changes have you seen in your field in the past 5 years? So we'll go back to this question, and we can start with Dr. McKinney.
I think I answered that one. We were talking about women in leadership. Mm-hmm.
Did everyone? I think you were the only one, right? So Dr. Robinson?
Oh, and I love that Christy has made me a doctor. I think that must be, you're putting it in the universe. No, I like that. That's like divine intervention. I believe in it. Put it in the universe. So maybe I'll talk to you later, Dr. McKinney, how I make that happen. But I go back to, and it's Shelley began to talk about this a little bit. She and I both brought this into the conversation, but I think the pandemic, the George Floyd moment, I think that was the moment that ushered in change. The question will be how much of it stays, but I just think we all of our institutions, many sectors had ideas about how to change things. And we were suddenly in this moment where we had to figure out new ways to do things, new technology. I can remember, again, in the food space, so many policies were changed automatically and immediately to get families more access to food, whether it was through SNAP programs, like all of the red tape, the bureaucracy, the things that are done to sort of lock families out of opportunity went away. There had been a movement around something called universal basic income and cash assistance. And the city of Chicago took the moment to leverage the federal ARPA dollars that were coming in to create the largest cash assistance program in the country's history. Now, cash assistance is something that Dr. Martin Luther King advocated for. So it's not a new idea. Dr. King started the movement to advocate for this work. It would be former Mayor Tubbs in California who would pilot the first small pilot, but it would be Chicago that would have the largest pilot in the country that would get payments, monthly payments to families, 12 months of $500 payments a month for 12 months to Black and brown families, to women with children who just can't make ends meet. And I just think that's a tremendous effort. It's historical. It's being evaluated. The early learnings have been that when you trust families and give them the resources, they invest in the family, right? They invest. There's mythology around, well, if you give people money, they won't work. No, the study is proving out that's not true. It's actually that it frees people up to figure out, well, do I want to go to this training program? Now I actually have the resources to go do it because I'm not working for low paying jobs where I don't learn anything. I actually have the space to take this training program, get that certificate, get this new job, whatever it is, invest in my kids' school supplies and give them opportunities, tutoring, because I can't get it otherwise. It unlocks so many things. And that's just one example. And the YWCA, we were the community outreach lead and partner with the city of Chicago on this massive program. And now we are continuing that work with domestic workers who are the people who basically clean up our messes, take care of our children, do all the things that a lot of us feel like we don't have the time and space to do. But they aren't always compensated adequately for how they actually help our economy run. So domestic workers, we're working on a project now to get them payments as well. So I'm just excited that for me, that's a bit of the change. It's also around equity, this ushering in of leaders and people of color. Corporations have made huge commitments around equity. It's about how do we keep the momentum behind all of it?
Great answer, great answer. We're well into the questioning, but please, if you just want to chime in, that's fine too. I'm calling names, but you could just chime in as well. Everything is exciting, so don't wait for me. Dr. Walker.
So just to kind of, again, add on to what others have said, the last few years have highlighted the importance of not only data, technology, what other panelists have mentioned, but also the infrastructure that is needed to prepare and respond to existing needs and future health threats, which are increasing in both frequency and severity. And the failures of public health data systems reflect the consistent lack of funding of public health. And before the pandemic, the last influx of public health funding for data modernization came from the 2010 Affordable Care Act. But thanks to new funding from the CARES Act and ARPA funds, which Nicole mentioned, there's been improvements from those early pandemic days when the weaknesses of public health data systems were exposed. But our public health infrastructure continues to be underinvested. And you may recall that the president signed the several coronavirus stimulus bills that directed the CDC, the Centers for Disease Control and Prevention, to provide billions of dollars to local, state, and federal public health organizations to boost COVID-19 preparedness and prevention responses. And while these funds were welcome, they did not replace or necessarily improve longstanding gaps in policy and funding and communication. So as public health and healthcare workers, we continue to advocate for funding, which is imperative if we want to continue to improve the nation's health.
Okay, thank you.
I have to jump in there because Renee she's walking down my street right now. I have to say, I came into the field of public health in 2001, 2002. I was fresh out of graduate school. 9/11 happened. 1 month later, the anthrax attacks occurred. And at that time, the federal government recognized how severely depleted the US public health infrastructure was. And very similar to what we saw with COVID and the emergency preparedness funds that were allocated for COVID preparedness, the same thing happened in 2001. Congress appropriated $1 billion to be funneled into local and state public health for the specific purpose of building our country's public health infrastructure. At that time, it was to respond to bioterrorism events. And over the course of the last 21, 22 years across this country, we've built so much capacity, but within 2 years, we started to see that funding decline. There were a couple of spurts, one in 2007 when avian influenza was an issue and we got concerned about pandemics. Again, listen, people, we got concerned about pandemics in 2007. And then we had another blip in 2014 with Ebola. And then, as Nicole has mentioned, COVID. What's my point? My point is part of our challenge as Americans is something happens, funding gets infused, we react, the funding goes down, and then we're not concerned again until something else happens. We get complacent. And I think that's part of our challenge. We have to, particularly for those of us that are in healthcare and the nonprofit sectors, because we see those and we work with those who are the least among us. And so we have to get active, we have to get vocal, and we have to challenge our colleagues, our clients, our constituents, if you will, and our elected officials. We cannot continue to be complacent because these things are going to keep happening. And, I shudder to think about not if, but when the next pandemic is going to happen and what is our level of preparedness going to be. How much infrastructure have we developed as a result of COVID and all of the funding that was infused into public health for COVID? How far can that take us down the road, and how are we going to build on that? So thank you for allowing me to be on my public health soapbox for a minute, but I had to get it out there.
Thank you. Thank you. We're going to go into one last question. Wrap this up. What skills and resources do emerging professionals need to be set up for success in these fields? So in your public health and community and not-for-profit and health, what skills do they need to be in these fields? Go ahead, Shelley. Share with us. Thank you.
Sure. Thank you, Christy. And great question. Again, with looking at this within corporate social responsibility within healthcare, I would say it's definitely imperative to be able to be forward-thinking, to be innovative, collaborative, and also to really be focused on relationship building, because you can't get anything done by yourself, as you've heard that from many of the panelists already. And you have to be intentional with those relationships. And so to really make sure that you are building those relationships with the right intent, that you're building them not only internally, but also externally, build out your network. Talk with individuals who are in that space that you're looking to get into, have those coffee chats, if it's virtual or in person, step out of your comfort zone, join some affiliate boards or professional development opportunities, really embrace those, listen to webinars and really try to get an understanding of the work that's happening now. And really, challenge yourself to think about how you can move that needle in a different way. Again, with COVID, it's really positioned us in a way that we can really embrace this innovation that we're in. It's really encouraging us to think outside of the box. And so I would really encourage you to do that and build your network and build those relationships.
Thank you very much.
Mm-hmm.
Dr. McKinney.
Thank you, Christy. I love what Shelley just said.
Yes.
And I would like to underscore what she said about relationships. I talk to a lot of young people and especially early career professionals. And, you know, we are post-COVID at this point. A lot of workplaces are either still remote or hybrid. And I've had so many young people say to me, oh, I can do my work just as well at home as I can in the office. And my very quick response is always, no, you can't. Because when you are home, you don't have the opportunity to interact with your colleagues and others that are within your profession. And I think oftentimes we undervalue how critical those relationships are and how critical those relationships can be to professional growth and advancement. And so I just want to highlight that as an add-on to what Shelley said.
Thank you. Dr. Walker?
So to the conversation, I would add perseverance, drive, again, underscore innovation and patience. I think we're working in an environment where we're expected to do more with less, and that could be less funding, fewer employees and personnel within our organizations, as well as outside to those organizations that we collaborate with. So being innovative, forward thinking, again, I think Shelley mentioned, and being patient.
Thank you. Yes. Nicole?
Sure, a couple things to build on. One of my favorite superpowers in the world is curiosity. I love people who are curious. I interview for curiosity and learning agility, because we're all experts in something, but no one knows everything, right? And recognition that you don't know what you don't know, and asking questions, being curious about things. I know you can figure it out. So I love that. The bridge builder, being a bridge builder is key. It leans on that collaboration piece. And to me, that's important when I think about social change. And we're in this moment in this world, even though we've had a lot of momentum in the post-pandemic world, but we are becoming more polarized from a community, from a state, from a country perspective. And we're putting stakes in the ground. I'm at this moment where Roe v. Wade was overturned, you know, and I don't know that everyone understood that was coming and that was going to happen. But I mentioned that to say that the world can change around us, and people we don't all believe the same thing. So that bridge builder thing is really important to try to figure out how we get us to a place that we need to be. And that also leans into this idea of advocacy and understanding the systems changing, because we can all do good work inside our institutions. But if the policies landscape changes in ways that work against us, we're not going to get anywhere. We're not going to achieve the lofty missions and ambitions that we have. And then one little nugget for business acumen, because no matter what industry you're in, there are budgets, there's money, it's just understanding how business works. Because as a nonprofit, I'm a business. I know we use that term, but we operate like a business. We have HR, we have finance, we have all these other things. And that's really important, that infrastructure, and that's how we win. So from a leadership part, we all need that no matter what you do.
Awesome, thank you very much. We have a couple of minutes, so we'll give each one of you about a minute. If there's one thing you hope the audience takes away today as a result of this conversation, what would it be? And so I'm going to start with you, Dr. Walker. If there's one thing you can leave with the audience, what would that be?
Oh, good question. Just one. My ask is that the audience at their respective institutions advocate for safe jobs and working environments where women are recognized, heard, and compensated equitably for their contributions, environments where women are empowered as decision makers and offer paths towards leadership. That's my one thing.
Thank you. Dr. McKinney.
Yeah, I would say, this panel was all about women in leadership. And I think what you've seen is, 4 women discussing and giving our thoughts on multiple issues and topics that are relevant to women in the workplace. I think one thing that I would want to leave with the audience is that, if you have a desire to lead, you can do that. Opportunities are out there. It's just about preparing yourself to be ready for those opportunities when they come your way, or having the confidence to go for the opportunities that you've identified yourself. There are resources that you can utilize, whether those be mentors, sponsors, training programs, career advancement programs like LGC and Impact that we've talked about. But again, prepare yourself. And as I say, stay ready so you don't have to get ready.
Sounds good to me. Thank you. Shelley?
Thank you, Christy. Yes, I would say, stand up and raise your hand. Make your presence known, and you can do that in a humble way. Don't buy into the notion that it's too late or it won't happen for you. What's for you will be. You are purpose-filled. Dreams don't expire. And if it's something in you that's stirring you up still, or it's invoking you to move, then move on it. Time is of the essence. And we know that, if anything that this pandemic has taught us, it's taught us that, right? And so don't stop moving and don't stop dreaming. You are needed, and now it's time to move.
Thank you. Well said, well said. Nicole, you have 30 seconds.
Great. Well, real quick, Ariana Huffington talks about historically about this idea of the third metric, and that often we make decisions about our careers squarely rooted in power and money, but the third metric is about impact and well-being. And for me, that's about, what are you trying to change in the world? What is it? What's your legacy? What is it that you want to do? And let that guide your decisions. I had a time in my career where I was at a crossroads, and I chose a path that I was discouraged to do. Mentors, members of the kitchen cabinet said, don't do it. It's a dead end. You'll never get promoted. You'll never get equity compensation. But I knew this third metric idea and what I was trying to achieve, and I pursued it. And everything that they said would happen would not happen, happened. I got promoted multiple times. I succeeded the person who originally hired me. I got the equity compensation. I got to travel around the world to Brazil and Indonesia and Ghana and the Philippines and all these places that a little girl from the South Side never imagined, could even conceptualize that I would go, and it happened. So know what your third metric is. Know what that is and use that as your guidepost.
Beautiful, beautiful. It has been a pleasure to be you guys hosts on today, the moderator, this platform. I couldn't imagine it, and I'm glad I didn't, because I'm full. So thank you for working with me, and I wish you all the best. We will now talk with our co-host, Kelly, who is our Chief Strategist Officer, who will end the series for today. Thank you all.
Good morning, everyone. I'm Kelsey Falk. I'm the Chief Strategy Officer here at SOS Children's Villages, Illinois, and I am the chair of our Social Justice Committee, which presented the Women in Conversations series this March and has presented Women in Conversations the past 2 years. So this was our 3rd annual. To learn more about our organization and our social justice efforts, please do check out our website and follow our social sites. I want to start by thanking Dr. Delphine Rankin, our CEO, for her opening remarks and for her leadership and vision in creating this conversation series. And thank you to Christy for the work you do every day within the organization and for moderating today's discussion. Thank you to our wonderful panelists, Shelley Long, Dr. Suzette McKinney, Nicole Robinson, and Dr. Renee Walker, for sharing your experiences and advice with us today. And thank you everyone for joining us today. I hope you enjoyed the conversation. Want to close by sharing just some underlying themes and words of wisdom that stood out to me from today's conversation. It seems that in health and nonprofit work is really interlinked with working to combat racism and social inequities. Regarding what prompted our panelists to get started in their fields, it seemed each spoke of personally experiencing or witnessing inequities in their communities, such as healthcare inequities here in Chicago and even when traveling abroad. And they all had a desire to empower others and improve the communities we are in. Shelley advised that you may not know a specific career even exists, such as corporate social responsibility, but to follow your passion and find a career path. Regarding what obstacles face women within careers in health and nonprofit, Dr. Walker spoke about pay transparency and pay equity, as well as family obligations that tend to impact women more often than men. Dr. McKinney spoke of how women often get assigned the non-job description responsibilities, such as party planning or office decorating for holidays, and that as women, we do rise to the occasion, but sometimes doing so pigeonholes us to these roles. She advised us to not be satisfied with other people's expectations and to not let ourselves be limited, and provided us with the saying, "Stay ready so you don't have to get ready." Nicole talked about how public policy impacts all of us, yet public policy is not a diverse field, and the decisions made within it impacts us all. Regarding how not to get overwhelmed when battling large systemic inequities, Nicole spoke about relying on your network and being able to get away from the work to recharge. Also, the importance of having space outside of work. Dr. Walker agreed and also advised to set boundaries for yourself and for your time. Shelley advised to take things one step at a time and to know it's okay for you to shine as well as to shine next to other women, that shining together makes the whole room brighter. In speaking about misconceptions surrounding women in healthcare and nonprofit and how we can combat these misconceptions, Shelley advised to raise your hand. Someone might not call on you, you might be overlooked for opportunities, but you can create your own opportunities. And Dr. McKinney shared that as women, we show up and are compassionate, and sometimes others interpret that caring as a weakness, or that being a good worker means we won't be good leaders. But that doesn't mean that, and she advised us to just move forward and show people what we can do. Dr. Walker added that in order to combat these misconceptions, we need more women in leadership. She spoke of the imbalance in the ratio of female healthcare workers to those women in leadership within the healthcare system. Nicole agreed and said that leading with a head and a heart is a superpower rather than a weakness, and that we need to advocate for more women and for more people of color to have these opportunities. Dr. McKinney spoke of how more women, and specifically Black women, are taking on more leadership roles, and it is showing society and the workforce that all that women can do. We need to be intentional about helping develop and pave the way for the next generation. Many people asked about the role of mentorship, and Nicole spoke of the difference between mentorship and sponsorship, which, if you've been following along with the series this year and the last 2 years, that is a common theme. It seems that many women in the workforce are very much interested in learning about mentorship and sponsorship opportunities and questions about how to pursue those. The panel also spoke about the importance of working with organizations and the broader community as the issues we face within healthcare and nonprofit fields, such as poverty, racism, violence, mental health challenges, those are systemic and interlinked issues, and how the pandemic has exacerbated all of those issues. We need to work together, and we need to challenge our elected officials to do better as well. It was a wonderful conversation. There were so many thoughtful tips and advice and words of wisdom. I couldn't capture them all, but we did record this session and it will be shared. So thank you again to our panelists, and thank you everyone for joining. This may be the final panel in our series this year, but please don't let the conversation stop here. Please share these valuable lessons with others and help to continue to make every day a safer, happier, and healthier place for women and others who could benefit from this support. Thank you.